Are there alternatives to colonoscopy for cancer screening? Are you wondering if there are options besides colonoscopy for cancer screening? You're not alone. Colonoscopy is often considered the gold standard for checking for colorectal cancer. It's effective at finding and even removing precancerous polyps during the procedure. However, there are indeed alternatives available that cater to different needs and preferences. One option is sigmoidoscopy. This procedure focuses on examining the lower part of the colon. It is less invasive than a full colonoscopy and typically requires less preparation. However, it does not cover the entire colon, so it is often recommended for people at lower risk of cancer in the upper parts of the colon. Another alternative is stool DNA testing. This non-invasive test analyzes stool samples for genetic mutations that may indicate cancer. While it is generally less accurate than a colonoscopy, it can be a convenient choice for those who prefer to avoid more invasive procedures. Computed tomography colonography, also known as virtual colonoscopy, is another method. This technique uses CT scans to create images of the colon. It is non-invasive but still requires bowel preparation similar to a traditional colonoscopy. Additionally, it may expose patients to some radiation. Emerging technologies are also being developed. Researchers are exploring non-invasive blood tests that could detect cancer biomarkers. These tests show promise but are still in the early stages of development. Circulating tumor DNA tests are being studied for their potential to detect cancer through a blood sample, although they are not yet widely used for colon cancer screening. Another innovative approach is panoramic photoacoustic computed tomography. While primarily researched for breast cancer, there is potential for this technique to be adapted for other types of cancer, offering a non-invasive imaging option. When considering these alternatives, it's essential to think about their accuracy and effectiveness. While these methods can provide valuable information, colonoscopy remains the most reliable option for detecting and preventing colon cancer because it allows for the removal of polyps during the procedure. Each screening method has its own risks and benefits. Non-invasive tests may reduce discomfort but could also have lower accuracy rates. Therefore, it's important to choose a screening method that aligns with individual risk factors and health status. In conclusion, while colonoscopy is the preferred method for colorectal cancer screening, there are several alternatives available. It's crucial to consult with healthcare professionals to determine the best approach tailored to your specific needs.